360 Living. I'm here with Dr. Keith.
Hi.
And I'm also here with two lovely ladies. And we're here to answer some questions regarding pain. September is Pain Awareness Month, and so we just wanted to bring some light to it.
The first one is from Mary in Poplar Bluff. She said that I've read that pain medication affects men and women differently. Is this true? And if so, why does it do that?
Yeah, Mary, that's a really good question, and just I want to shed light. So it is kind of a misnomer, a myth that men and women react to pain medications different. But what I want to broaden that to say is that humans react to pain medicines differently, and pain medicines are not gender biased, okay? And so what really it comes down to is how your body metabolizes, period. And that could be medications, that could be foods, that could be vitamins, that could be anything. And it goes even further down to the genetic level. And so there are many pain medications and other medications that are metabolized through the liver. It's called a CYP system, CYP enzyme system. And genetically, we are all different in how we metabolize that. Now, pain medications are not the only drug that goes through the system to be metabolized, and so many drugs go through this. So what does this look like in real life, Mary? And this might be something that you're familiar with, and maybe you guys are too, but you've heard of people who will say, well, I took that such and such pain medicine and it did nothing for me. And then the same person will say, well, I took it and it knocked me out. What gives? You're a woman, I'm a woman, or you're a man, I'm a man, or whatever. Well, what gives is your ability to metabolize it. And so drugs are metabolized into inactive forms, or metabolites and active metabolites. And some, when they go in your body, they're active and they have to be broken down into inactive. Well, if you cannot break that down into inactive and you have a overabundance of active, that really gives your body this opportunity, unfortunately, to be getting too much. And in getting too much, you get side effects, or you get a very bad effect. And if you metabolize drugs quickly through that system, and you metabolize them, in this instance, into an inactive form, then what that does for some people is it gives you the appearance of it did nothing. More is not always better in the instance of pain medications when someone's not feeling an effect, because there's kind of someone in the middle who builds up and then they can't break down, but this builds up, and then all of a sudden they'll have a tsunami effect of badness. And so I think your question is very, very good and insightful, Mary. I appreciate that question. It's a question I've gotten a lot in my 10 years as a pain doctor, and honestly, we don't know how someone is going to react. Now, the world of pharmacogenomics is coming. You know, the genomic era where they discovered the human genome and they thought everything that ails us is going to be fixed through knowing our genes. Hasn't quite lived up to that expectation at all. And so while it's helpful, it still doesn't absolutely answer it. And the reason is because you know, with the average American being on 12 drugs at one time, who's to say that one of these drug systems is not affecting the other drug metabolism? So, excellent question, Mary. I appreciate it. What other questions do we have?
Well, we have Cheryl from Jackson.
Okay.
And she says, I have carpal tunnel in both of my hands. The pain is almost constant. The nights are the worst. I'm thinking about having surgery for this condition, but I have also heard that it doesn't necessarily work. Is that true?
Mm-hmm. Thank you for your question. So let's speak about this. So pain and surgery. So carpal tunnel is, as you know, a progressive. Most people develop carpal tunnel with overuse. So the thing we hear most is typing, right? And what is carpal tunnel? Well, simply it is an inflammation of the median nerve. And the median nerve runs through the carpal tunnel here in the wrist. It's literally a tunnel. And when that nerve gets inflamed from overuse or otherwise, it will get pinched or trapped. And that then causes pain, sometimes not pain, sometimes just numbness in the hand. Worse at night, usually the reason there is because the swelling or the fluid buildup happens overnight and during rest, and so you'll wake up and have to, some people hang their arm off the bed, some people shake. And conservative measures such as bracing or heat, these kind of things will help for a period of time, but as she says, she's reaching that point where she's considering surgery. So most surgeons require a nerve conduction study before they will even entertain a surgical option. On that, you will be having a test on the actual median nerve. They'll rank it mild, moderate, or severe. And then the surgeon would usually have a consultation with you where they'll say, you know what, yeah, it's bad enough to have surgery, but how bad is it bothering you? And a lot of surgeons will say, you know what, it's not time for surgery till you absolutely cannot stand it. Now let's go into, does it help? Well, the statistics are going to be a little skewed on any surgical procedure, frankly. And the reason is because, well, we don't always know, because people who don't get relief won't always go back to their surgeon and tell them they didn't get relief, okay? And people who get relief or get relief don't always go back and tell them how long they got relief. Does that make sense? Mm-hmm. But all that really matters is if it works on you, then it's 100% great and effective. And if it doesn't work on you, then what? Guess what? It's 100% a terrible surgery. And that's just how we are. And so we do the best we can, and surgeons do the best they can in trying to educate patients into what is involved with the surgery, more so what's involved with the recovery, because in many instances the recovery is more important than the actual surgery itself. The surgeon is skilled, they do their best, but if that recovery time period is not followed to a T, then things can happen. But you know, here at 360 Living, what we also recognize is there is a nutritional component and a base, a foundation that will potentially help fill in those nutritional gaps for a better recovery and a better outcome. And so that's where we focus. And so while I can't say, does it help, does it not, it's individual specific. We take statistics as they are for what they are, and you try to do the best you can. Have confidence in your surgeon if that's the route you go. If you want other options, we'd be happy to talk with you about those here. Other questions?
Okay, well, Erin from Keith Gerardo asked, is it true that some people have a higher tolerance for pain than others? Is there a difference in pain tolerance or perception with the gender?
Right. That's a great question, Erin. I get that question a lot too, and I've gotten that question a lot in my 10 years of being a pain doctor. And the simple answer is no, there's no difference. But when we talk about pain, pain is very subjective. And if anyone has heard of this 0 to 10 scale, they tried to make that the fifth vital sign as an effort to objectify the subjective. But that is a very difficult thing to do, isn't it? How do you objectify something subjective? How do you put into objective words a feeling? It's hard. And so the number scale is what came out of it. But the fact of the matter is there is a tolerance. And what is the definition of that? Well, it is where so I'm going to put my hand in some hot water, okay? And at the same temperature, we're all going to put our hands in the same bucket of water, okay? Mm-hmm. And I might rate my pain as a 7, okay? You might rate the same feeling to your body as a 5. You might rate it as a 2, and you might rate it as a 12 or a 15, okay? But we have the same stimulus. So what gives? It's similar to really points of what we've already discussed, genetics, okay, and also nutrition status, what's on the cellular level, how are the health of the nerves, overstimulation, understimulation, and then we also have to talk about other subjective things, happiness, okay? You can read about how the mindset and the state of joy, in fact, had a role in, let's go back to history and let's go back to men who participated in the wars. And you can go back and see that a lot of men who are in excruciating, pain, they said that the joy of getting out of the situation of war far was much better than the pain they were experiencing in the moment. And so mindset is a huge thing. And so when we talk about pain, we have to think about multiple facets of pain. Pain is not one-dimensional like we used to think. It is not simple for most people, and especially anyone who has suffered with chronic pain greater than 6 months, if you will. There is a psychological effect there. There's an effect on pain, mood, and sleep. And when I draw this out for a lot of people, and it looks like a Venn diagram, and in the middle is where they all three connect. And so how it works is, if your pain is worse, then guess what? Most likely your sleep is not going to be as good, and you're probably not going to be the happiest person. Okay? But if we can find a balance where, you know what, I was able to get some restorative sleep, and you know what, I was a little happier the next day, and you know what, yeah, maybe my pain was a little better. Okay? Those are the steps for long-lasting and embracing the pain. That's a great question, Erin. I hope that helps with the pain focus for this month. I would just emphasize that there are solutions out there for you. Here at 360 Living, we do great work for people who have been struggling with pain and who might not have found that solution yet. Specifically for neuropathy, if you're suffering with neuropathy, well, what is neuropathy? Well, words you may know: restless leg syndrome, carpal tunnel is a type of neuropathy, pain, numbness, tingling in the extremities from an issue with the peripheral nerve. We have great success with that around here, and if you're looking for an option, call, get some more information. There's no reason to suffer when you have tools that can help you. I hope you guys have a great day. Thanks for joining us.
Bye.